So, see, you'll have to do your upper jaw surgery now, for sure. You'll have to just take it up.
Okay.
And then genioplasty we can do. This side, maybe we can let it remain. Sides maybe not needed really for you. Just smile a lot. Yeah. Front, yes. And genioplasty, yes. But side maybe no.
And if you see my face, no, it is not in a proper shape.
Slight asymmetry is there. That's okay. That's not a big deal. We'll correct it when we're doing all of this.
Okay.
So see, the main issue is the gummy smile.
Yeah.
Because in your show, it looks pretty awkward. Teeth seem to have come down on the shape of your smile and the gum exposure. So that's the main issues. At that time, we can improve the chin a little bit, but not a lot.
Okay.
Here and all, we don't need to do anything for you. It should be fine.
Huh?
It should be fine
I'm
without.
thinking, no, if I see 450 up,
Yeah.
now it is coming for a proper shape, I think so.
You want it so strong?
Not required. I'll talk to your manager first. Then later I'll take a decision about that.
You mean with regard to costing?
Yeah.
See, costing is secondary. First, we have to decide what is best for you. There's no point doing a procedure if the cost is less. Doesn't make a sense.
Okay.
Suddenly he says cost is less, so we'll do the surgery. No, not like that.
Okay.
We first say what is the best procedures for you. Then you see if that can be afforded immediately or do it later also. This is not an emergency thing.
Then
That is definitely to do.
yeah, this one.
That one. So I'll split up and write. So then you can have a talk with him.
Okay.
But I don't think we need to do any angle osteoplasty for you. Don't do unnecessary things. It'll automatically become nicer.
Because
Once a
this is
balance.
from this side, like wobbly side, and this is little bit.
Little bit, but when you correct all of that, it'll improve.
Okay then.
It should improve.
Then doctor, can we remove this now?
What's there? It looks nice. Why do you want to remove that? It should go a little bit more inside, but then your angulation little down. You shouldn't remove that. I know the eye. You shouldn't remove that. That's the medial canthus. That's not something you should remove. That's normal. It's just a little different downward for you.
Photo and all, and close photos and all, it's look like little bit.
No, you shouldn't do anything there. Shouldn't do. All right. So we'll plan something for you either tomorrow, if you're okay, or any time later after that. All right.
Yeah. Then slightly I want to see if you see this.
Yeah. Nose we can improve,
Slightly this.
but that will be an rhinoplasty.
No, slightly only this thing.
Still, if you have to work on the tip, it takes a lot of time.
Then I'll go next time.
You leave it. No need now. If you want me to reduce this width a little bit, I can reduce. That's not a big deal. But if you want me to work on the tip, I'll have to do a full nose job. And you're already doing upper jaw, so I don't think it's required. You won't need it. Trust me. Sorry. So what you do is, now that we know the procedure, the plan exactly, so you can talk to this guy and then plan it for tomorrow or whenever you want to and let us know. All right? Chal, good. Yeah.
Thank you.
See you. We'll see you again tomorrow or whenever you decide for surgery. Yeah, sure.
Okay, now I can talk to your manager.
Yeah, you can talk to him if he's around. Unmuted.